All right. Good evening, everyone. A very warm welcome to all of you joining us today on Homeopathy 360. I'm Dr. Nouri, Senior Editor at BGN Publishers, and it's a pleasure to have you all here. I'm especially delighted to welcome our esteemed speaker, Dr. Archana Kabra. Ma'am is currently working as an associate professor and head of Department of Organon of Medicine and Homeopathic Philosophy at Government Homeopathy College, Jalgaon, a position she has held for past 3 years. She brings with her over 12 years of rich teaching experience in Organon. With a deep passion for reading, teaching, and practicing homeopathy, Dr. Kabra has published several articles and case reports in both national and international journals and conferences. Her contributions have been recognized with honors such as Best Researcher and Best Paper Presentation at the international level. But her accomplishments go far beyond academia. She is also an ultra marathoner, having recently completed a 90-kilometer Comrades Marathon in South Africa, a truly remarkable feat. In addition to being a fitness enthusiast, teacher, practitioner, and a mother of two, Dr. Kabra also nurtures a creative side with a love for wall painting and cooking. Also, she has been a contributor to the book Spirit of the Organon by Dr. T.C. Mandal. So in today's webinar, ma'am will give an overview about miasms, helping us understand miasms in the context of vital force, a very important topic indeed. I welcome you, ma'am, on Homeopathy 360, and we are really thrilled to have you with us today.
Uh, Thank you, Dr. Nouri. It has indeed been a very comprehensive introduction of me, and I am really glad to be here. And I thank the entire team of Homeopathy 360 to have me on board here today and present my the bit of knowledge that I have about miasms. Of course, I am excited to present that as well. I guess we should start it by now, and
Yes.
I'll just share my screen and my presentation right away.
Absolutely. So while ma'am is sharing her presentation, I request the audience to drop their questions in the Q&A box given below so that we can take them in the end. Ma'am, the digital stage is all yours now.
Thank you. Is my screen visible?
Yes, it is.
Yeah, all right. So, I am Dr. Archana Kabra, and I have 12 plus years of teaching experience in the subject of organon of medicine. Uh, since 3 years, I am working as associate professor and HOD in the Department of Organon of Medicine and Homeopathic Philosophy in Government Homeopathy College, Jalgaon, Maharashtra. And while teaching organon over the period of last 12 years, I have actually understood organon better rather than what I did while I was a student. And I realized that the one place where all of us homeopaths fall short in prescription is miasms. It is extremely important to understand this concept of miasm and to imbibe it into our practice so that we can have much good results with homeopathy. And I always follow this teaching of Dr. Hahnemann. He says that if you are not getting a result, it is not the problem with homeopathy. It is the problem with the homeopath. Probably the homeopath is not able to reach to the correct simillimum to bring about cure. And I think miasms is the bridge between us as good homeopaths and best homeopaths. So yeah, let's continue with this further. Okay, let us first understand what miasms are and how did they get discovered. So in over a period of time when Dr. Hahnemann was practicing, he realized that there is something which is blocking the cure process. Now, there are acutes and there are chronic diseases. In case of acute diseases, we see that you give a remedy and the patient feels better. And in case of chronic diseases, if there is an acute exacerbation or even when the chronic disease is in the active mode, you give a remedy and the patient improvises. But these chronic diseases were not cured per se. So, according to the aphorism number 1. So then Dr. Hahnemann went deep into it and understood that there is something which is blocking the cure of chronic diseases, and that some block is actually the miasm. It is the primary cause, the root cause of all diseases. And when he spoke about this, he also understood this as energetic blocks, where there is some deep inherited or acquired influence that has created that chronic illness in the patient in the first place. And this block, unless it is completely removed, cure cannot take place. We might just palliate, but not cure. So, relapsing persistent disease in homeopathy, according to homeopathic philosophy, any sort of relapsing or persistent diseases need to be taken care of in another way and not in the way any allopath would see a disease, or a disease is seen in the way of the current scenario of, yeah. So now historical breakthrough happened in 1828 when he did a revolutionary discovery. He wrote the book Chronic Diseases. And in this book, he has clearly explained that miasms are as a morbid family tree of disease. And it totally changed the fundamental view about chronic illnesses. He said that miasms are pervasive, invisible forces that shape our susceptibility to disease and influence how an illness evolves over time. That means all of us know the concept of vital force. What is vital force? It is that force, that energy, that power within us, within each and every one of us, which is totally involved in keeping us healthy. So its responsibility is that we are totally healthy. So by hook or by crook, the vital force always wants us to be healthy. That's it. And now there is this, the other side of the coin, which is the miasm, which is always raising its heads up when it comes to know that the vital force is not capable of reaching to its full potential of keeping you healthy. So now we have, two sides of the same coin, where on one side it is the vital force, which is putting its all energy, ji jaan se effort, that yes, you should be healthy mentally, physically, socially, spiritually, everything that is included in the WHO definition. And whenever the vital force is weakened by some reason or anything, there is this miasm, which is also present in us right from birth, like our vital force. Sorry, right from conception. Okay, so this miasm, it comes up like a heads up and it starts showing its effects. And uh, these deeper patterns were actually Dr. Hahnemann's vision that the highest calling, or the physician's high and only mission, is to restore the sick to health, to cure as it is termed. So if we are looking at cure, and if we know that diseases are caused by derangement of vital force, we also know that as the vital force is deranged, the latent miasm turns up, it becomes activated, and it starts producing signs and symptoms in an individual. And that is when the disease comes in. That is the key insight which is mentioned over here, that miasms work in direct correlation with the vital force, affecting how our life energy responds to the disease challenges. Dr. Hahnemann described miasm in three basic types: Psora, Sycosis, and Syphilis. Let's understand each one of them one by one. So, what is Psora? When Dr. Hahnemann was explaining about miasms, and even in his chronic diseases, he has told us that Psora originated from the skin. Now, why do we say this? Or after learning organon in so many years, I have realized this, that why did skin come as first? We also know Herring's law of cure. And in Herring's law of cure, and in embryology as well, and when we study all the other theories that we have in homeopathy, we realize that the skin is the organ which is the most superficial. Yes, it is very important, but compared to all the other organs, it is the least important organ. So whenever our vital force gets a little deranged, whenever there is an activation of the latent Psora or the latent miasm, the disease will first appear at the level of skin. Now, this was there when, right from the time the diseases had started, that is, right from the time mankind was there. And over a period of time, miasms have got complicated. So Dr. Hahnemann labeled this first miasm, the starting of all the miasms, the mother of all the miasms, as Psora. wherein all the inflammatory conditions, again, now, why do we say inflammatory? Because yes, it starts on the skin. But when we study physiology, when we study all the other subjects, we understand that the first level of after an infection comes in, the first thing that occurs in our body is inflammation. That is why Psora is correlated to inflammation. Okay, so any inflammatory process that happens in our body, anything, not anything, anything and everything that occurs on the skin, but any inflammation occurring in any part of the body is considered as a part of the Psora miasm. That is why it is said the oldest and the most common miasm, primarily linked to skin issues, allergies, chronic weakness, and underlying deficiency patterns that create a susceptibility. Which means because of Psora miasm, whenever it is activated whenever there is a deficiency in us. It is activated whenever there is an infective process, initial part of an infective process in us, and things like chronic weakness develops, and then this is where we understand that the vital force is now deranged and it appears in the form of Psora. Let's go to psychosis. Now, when did psychosis come into picture? Dr. Hahnemann said that all the diseases are not just inflammatory. There are certain diseases which might have a different origin, and that origin could be related to genitals or reproductive organs. Okay, so whenever there is a disease which starts from the venereal origin and from there it passes through the entire body, causing different expressions, it can be either psychosis or syphilis. But if the pathology that is starting is of an overgrowth, we call it psychosis miasm. And the pathology, when it starts as a destruction, it is called as a syphilis miasm. Okay, so both psychosis and syphilis are venereal in origin, starting from reproductive process, starting by the reproductive processes from the reproductive organs. They are said to be psychosis or syphilis depending on their presentation. If I have to cut short and culminate this entire thing, I would say miasms are basically the way disease is presented. Okay, now this is very, very deep. Miasms are the decisive factors which decide how a disease is going to be presented. When I say Psora, psychosis, and syphilis are no longer simple miasms, they are complicated because we have been living for generations and generations and generations right since the time mankind was born. And in all these generations, there have been a lot of permutations and combinations occurring whenever there is a conception. At that time, the condition of the parents, the miasmatic stature of the present of the parents at that point of time decides the miasm of the child, the embryo. And right from there, that miasm just continues right after the birth until the death. Of course, the miasm is changing its complexity over a period of time. Every miasm now is present in every individual, and depending on the intensity of the causation, that presentation will be according to the miasm. The disease presentation will be according to the miasm that gets activated at that point of time. Okay, let's go to the next slide. This is a brief description of how the different miasms will present themselves. So Psora manifestations, when do we know that Psora is active? If there is dry, scaly skin conditions with intense itching, burning, hypersensitivity reactions, mentally, it can present as anxiety and restlessness. And see, strong desire for sweet and warm foods and all desires, aversions, etc., everything is being are counted to be under psoric miasm only. Then psychosis characteristics, overgrowths, any sort of overgrowths in the body in any format will be considered as psychosis presentation. So warts, cysts, abnormal growths, joint pain, stiffness, chronic urinary tract issues, cravings for beer, rich, heavy foods, etc., under the psychosis characteristics. For syphilis, thick crust, deep ulcerations, all these are presentations of destruction. Bone deformity, structural damage, strong aversions to meats, proteins, symptoms worsen significantly at night. We actually have a very, very long list of these manifestations under all the different miasms in our books. We already have them. This is just a brief, just a glimpse of the distinguishing features of the miasms. If you go to the next slide, we understand that looking at miasms from a practitioner's level is very different from looking at the same miasms from a student's level. Okay. Now, what are the use of miasms when we are actually treating a patient or when we are looking at a case? First thing is constitutional integration, which means what? We can understand the constitution of an individual by our case taking, right? What we are asking the patient will help us understand the individuality of the patient. So our case taking skills have to be at par. But apart from the case taking skills, we also have to understand the miasm from the information that is available to us, that we are asking to the patient. So, if we want to make a comprehensive understanding of the entire constitution of the patient, we have to know the miasms well. Okay, how do we do this? Combining deep miasmatic understanding with constitutional prescribing creates a comprehensive treatment approach that addresses both the surface symptoms and underlying predispositions. Our miasms decide what our predispositions are. So, if for any reason my psychotic miasm has got activated or my psychosis is active, background predisposition currently is of psychosis. If there is some ailment that has come to me, there is some causative factor, my body or mind will present in the psychosis fashion. I might get an overgrowth somewhere. There might be a fibroid. There might be a cystic presentation. There might be something like a lipoma, which is a collection of fat under the skin. There might be, in case of women, there might be some greenish offensive leukorrhea. Okay. None of this would be destroying the integrity of my tissues, organs, skin, etc. But they will lie as an overgrowth, as an extra growth in my body, which is not the normal growth. If I can understand that, yes, the miasm in the background is this, and I can also understand that the surface symptoms, that is the symptoms of the disease, symptoms of the individual, are these. And if I combine both of them, I can get an integrated constitutional picture. And this will help me in prescription. Now, if I consider the miasm here as psychosis, I would not be prescribing a remedy that is purely psoric or syphilitic. I would take into consideration a remedy that has a miasm, that is a psychotic miasm presentation. So my remedy could range right from natrum sulf to anything. See, I'm not pointing out towards any single remedy here. I'm pointing out to all those remedies which either have a tri-miasmatic predominance or a psychotic predominance. And with that prescription, definitely the chances of me hitting the similimum will be much more, which means that achieving cure will become easier in that case. Now, the second place where miasms become important is disease presentation assessment. We have to carefully evaluate how miasms are influencing the disease presentation. And hence, we can identify the patterns and predict the treatment responses more accurately. If we go into detail of this, we understand that if a miasm is active, the disease will present in a specific pattern only, which means that if there is an ailment, there will be a lipoma. For example, if there is another ailment, probably another lipoma will develop in a different site, or a kidney stone might develop, or a cyst might develop in some other place, or a chronic abscess might develop in some other place. Okay, which is again showing that this pattern is pointing towards the psychotic miasm presentation, which means that yes, psychosis is active, which means that yes, I have to take psychosis into consideration if I want to bring about cure in this patient. So, psychosis is definitely going to influence the disease presentation. Also, the causation depends. Third, susceptibility correlation. Now, if I can bring about and if I can know the miasm, I can correlate it with the susceptibility of the individual. The reactivity pattern will enable me to bring about more precise remedy selection and dosing strategies. Now, all of us know that susceptibility helps us finding out the dosage. If I know that there is a psychosis lurking in the background, I would know that this patient will require a dose, a low potency probably with repeated dosages, so that the patient responds well to the treatment. Now, each one of us know, whoever has read chronic disease, and of course, whoever of us is practicing homeopathy, and we know that what is the importance of susceptibility in prescriptions. If I am able to correlate miasms and susceptibility, I will also be able to uh, I will also be able to, I would be able to know that what is coming next, or what should I expect in this case in future. So if I know my miasm, and if I know that there is the miasm of the patient, if I know there is a psychosis lurking in the background, if I know that this is the way I am going to prescribe, this is going to be my dosing strategy, I will also be able to predict what can come next. If at all, if my treatment is going fine, if the cure process is going fine, I will realize that the next time this patient is having an ailment, probably he is not developing a lipoma. He's not developing the cyst. He's not developing any sort of any sort of overgrowth anywhere in the body. I am understanding that yes, the psychotic load of this patient is going down now. The patient's susceptibility is improving. The patient is now responding better. Why? Because the outbreaks of psychosis miasm, the outbreak of the disease, the response, the reactivity of this individual to the ailments is lowering down. I know the vital force is now getting more and more strengthened. The other side of the coin, that is the vital force side of the coin, is getting more and more strengthened now. That is the importance of understanding miasms in any case. Now, case management. Okay, we've spoken about this in the last slide, but again, I would like to focus on this. First is pattern recognition. Now, in practice, how can we use miasms? Pattern recognition, identifying miasmatic patterns through detailed symptom analysis, comprehensive patient history, and multi-generational health patterns. Of course, the past history and the family history that we ask to our patients are so very important in understanding the miasms, right? We can get a detailed understanding of the patient by the case taking, the current scenario, the past history of what the patient has passed through so far, right since childhood, whatever diseases that patient has suffered from, and the presentations of the individual sufferings, what the patient has gone through. And of course, the multi-generational health pattern. So the family history that we ask the patient is not just about father में कुछ complaints है या mother को कुछ complaints है. It is generational. So rather than stopping ourselves in asking the family history only up to the immediate family, we can go beyond and ask the family histories of our father and of the father and mother of the patient individually. And by this, we can understand the patient's history much better. And miasmatic pattern, if there is any miasmatic pattern, if there is any strong miasm that is lurking in the background, we can expect and predict the future diseases of this patient on the basis of the miasm also. Then we have relapse prevention. If we know that what the lurking miasm in the background is, we can actually prevent the disease relapses and achieve deeper and more sustainable cures. If whatever I explained in the last slide and the pattern recognition, if we can know the miasm by the past, we can know what this miasm is capable of causing in the future. And if we can predict that, if we can know that, we can know where, we can know how and where to stop it, how and where can we approach it so that the future relapses or the deepening of the diseases, appearing of the diseases in much deeper organs doesn't occur. And also, this leads us to long lasting results. That treating these miasms can create a foundation for long lasting cures that transform the health at the deepest constitutional level. And I think when Dr. Henneman told us or said that the physician's high and only mission is to restore the sick to health, to cure as it is termed. So, sick to health. Sick is everybody who is diseased. Sick is everyone who has this miasm lurking in the background, which is got aggravated. No, I would not say aggravated, which has come out from its latency and is now showing its roots and showing that the disease can occur in a particular pattern. Okay. Modern research and approach. Now, homeopathic treatment of miasms. I just want to, add a little more to this. It's not just miasms, homeopathic treatment of the individual, which involves treatment of the miasms and the treatment of the presenting picture of the disease. Not the disease, the individual. It shows promising results in chronic disease and post infectious states, including emerging conditions like COVID syndrome or post COVID syndrome. So, over a period of time, nowadays, we homeopaths, we have started publishing our articles, we have started publishing our results. And that is actually very good because we have started showing the way homeopathy works and the effectivity of homeopathy in the current world. So, post COVID syndrome, we have a lot of articles which are present, and we can all of us go through all those articles and understand that how miasms have played a role in the presentations of COVID in different individuals, and this treatment of miasms in the post COVID time have the knowledge of miasms used in the treatment of the individuals in the post COVID times have shown a lot of promising results in chronic diseases. Again, vibrational medicine integration. Modern approaches incorporates vibrational medicine and flower essences as complementary tools for weakening the deep miasmatic blocks and enhancing healing responses. So, or what are the different ways in which we can take care of the miasm or we can treat the miasm is vibrational medicine, flower essences. We all know about backflower remedies. All of these things have now been utilized more once we have now realized that miasms play such an important role in the presentation or in the appearance of the disease in the first place. Research continues to validate Hahnemann's original insights while expanding our understanding of how miasms operate in contemporary health challenges. Contemporary health challenges, I think I'm not much into understanding of what it means by contemporary health challenges, but as a homeopath in the mainstream, I think it is extremely important for us to understand that miasms are very, very important. I hope I am audible and visible.
Yes, ma'am, you are.
Yes, yes. Thank you very much.
You are.
Yeah. So, yeah, now for all the students, for all the teachers, and for everybody who's over here, these are the challenges that we face, and these are the opportunities that are really available to us. First is continuous learning. The complexity of miasmatic prescribing demands ongoing clinical experience and deep theoretical study, and embracing this as a lifelong journey of discovery. See, what we are presenting right now, what I am presenting to you right now, what knowledge that I'm sharing right now with you is after 15 plus years of practice, 12 plus years of teaching organon, and going deeper, diving deeper into Hahnemann's work that he's done. Of course, for teaching my students chronic diseases, I myself have to go through chronic diseases in the first place, understand it well, and only then I can be able to present it. And in spite of that, I still face a lot of problems, a lot of issues when I am thinking about miasms, or when I am trying to search for the miasms in a patient and understand. Because now, since I know the use of miasms or the importance of miasms in practice and in bringing about cure, I will go much more deeper into an individual, into my patient, when I have to understand that individual as a whole. So, yes, it is a complex process and it requires years and years of practice and understanding. And with the increasing demand of clinical experience, of course, it becomes much more important for us as homeopaths to have this knowledge of miasms for us. The second thing that comes as is modern integration. Now, combining the classical miasmatic theory with contemporary case studies, immersing research into to create a relevant and effective treatment protocol. We know homeopathy works on individualization, and miasm, constitution, presentation, everything is very individualistic. And we also know that nowadays, a lot of theories, even with us, okay, even as homeopaths, even when we do research, we are doing research so much so that this medicine or this remedy can be so good for this disease, right? So now the challenge that is in front of us is the classical miasmatic theory and the classical theories that Dr. Hahnemann has given us, and the contemporary case studies and the theories that we are putting up right now as a homeopath and as a classical homeopath, to relate both of them together and bring about effective treatment protocols. I think, yes, that is a challenge that comes up, that comes to our face. And wherever there is a challenge, there is obviously an opportunity. If there is someone who is ready to dive into this, combine both of them, the classical and modern aspect, and and come out with something that is much more effective, is definitely an opportunity for us. And community building, so fostering a collaborative community of practice where practitioners are sharing insights with each other, discussing challenging cases, and advanced homeopathic education together. Now this definitely is going to bring more opportunities to us, open a pavement for us to get into the mainstream as homeopathy, and come together to bring about cure effectively. We are not here to place ourselves or position ourselves or prove to others that yeah, homeopathy is good or homeopathy is bad or homeopathy doesn't work or homeopathy is working lovely, and all these things. No, I don't believe in that. I believe that our works talk for us. Our and this is the right time where we have all the opportunities to to actually prove to ourselves that yes, we as homeopaths are doing justice to our pathy. We as homeopaths are doing justice to what Dr. Hahnemann expects out of us, of bringing about cure. And I think miasms are one very important source or very important topic of understanding, so that our cures are more deeper and more integrated. Right. So healing at the root, just an overview of what we've done. Miasm represent the hidden forces behind chronic diseases and relapse patterns, and understanding them unlocks deeper healing potential. Mastery of miasmatic theory and practice is essential for achieving deep, lasting cures that transform lives. And together, let's deepen our understanding and transform homeopathic care nationally and internationally. Thank you. Thank you very much for being so patient and listening to me. And yes, I would be very much open to any questions and answers that are being put up here in the forum. Thank you very much.
Thank you so much, ma'am, for this very captivating presentation, which clearly shows your passion for the subject, particularly very engaging style for breaking down a seemingly difficult subject, especially for the beginners. But I guess even for the experts, there is a chance of dilemma at times because of the depth of the topic. So we do have some questions from the audience. Let's take them up.
Yeah.
Dr. Yashwantrao Patil is asking, can you please give me a reference from Organon for your explanation of hallmarks of Psora as inflammation, eruptions on skin and functional problem for psychosis as overgrowth and syphilis as destruction? So probably he's asking for the
Source.
aphorism.
Chronic diseases. You might not get into aphorisms. Yeah, of course, you will get into aphorisms as well. But I would like to suggest to Dr. Yashwant, you could please go and open the chronic diseases book. And I think you will get a very detailed explanation and understanding of what miasms Dr. Hanneman is talking about.
Right. And how many remedies he's asking are antipsychotic and antisyphilitic as per you?
I think I'm sorry for this giggle, but Dr. Yashwant, see, any remedy can be trimiasmatic, can be monomiasmatic. That means it is referring to just one single miasm. There is no number or no count of it. Okay. A remedy which is trimiasmatic can be used for psychotic as for a disease which is presenting in the psychotic miasm, in the syphilitic miasm, or in the psoric miasm as well. There are a few remedies that we know, that is king of Psora or king of psychosis or king of syphilis. If we say sulfur is king of Psora, do we mean that it cannot be used in cases where psychosis is predominant or syphilis is predominant? No, it's not that. Sulfur can be used in all the three miasms, though it is called the king of Sora. Similarly, natrum sulf, similarly, nitric acid, similarly, mercury, all of these drugs, all of these remedies, though they are called as king of that specific miasm, they can still be used. The knowledge of miasm we have so far, I think, is very superficial. We have to go deep down and understand. If we go and study our um, original work of proving of our stalwarts, we understand. When we read mercury, we will understand that in inflammatory stages also mercury can be prescribed, which is said to be inflammatory stage, is said to be a stage where Sora is more predominant, but mercury can be used even in those. So it needs a lot of detailed understanding of the subject. It's not just organon or miasms, it needs deep understanding of materia medica as well and the proving symptoms as well. Right? I hope I've
Very.
answered your question, Dr. Yashwant. Yeah.
Absolutely. Much details are given. Dr. Vishali Jain is asking, can you give some insight about tubercular miasm?
Yeah. So, Dr. Hanneman, towards the, after long years of practice, realized that there is some pattern which doesn't fall purely into Sora and purely into syphilis. So he came up with this sorosyphilitic miasm, which is named tubercular now. Okay, so over a period of time, the name given to it was tubercular miasm. Now, if I say Sora characteristics and if I say syphilis characteristics, and if I combine both of them together, Sora as well as syphilis characteristics, we would get an understanding of the tubercular characteristics. So I think this answers your question.
Yes.
Yeah.
Also, she's adding up that the recurrent abscess, that tendency, is it Sora or psychotic?
Yeah, so the presentation of it will declare whether it is Sora or psychotic. Now, abscess in the first place, it is if we understand what an abscess is. So yeah, glad you asked me this question because this is one point I think I missed while I was correlating with the miasms. The pathology, what happens in that particular disease, in that particular individual, the pathology is basically your miasm. So that means your miasm, the activated miasm at that time decides what pathology is going to occur in the body. So in case of abscess, what do we see? Abscesses are basically bursting open of the cellular wall where all the cells come together. There are dead cells inside that abscess. Okay. So here what we are seeing death, that is destruction. We are also seeing an overgrowth, which is we are seeing that a growth ball is formed within which there is dead tissue. And then that particular dead tissue is, degraded. Okay, so we get that offensivity and all those things, and we have this greenish discharges, and then it is infected also, super added infection. That is why we have this streptococcal infections, and those abscesses are occurring. So now, if you see the pathology, and if you understand what is happening inside an abscess, we can say that abscess basically is everything, all the three miasms coming together. Recurrency, recurrency is a feature of psychosis. So if these abscesses are recurrent, are coming up again and again, again and again, so it is a feature of psychosis. So recurrent abscesses, if you ask me, it's a feature of psychosis. But what happens inside an abscess is a culmination of all the three together.
Right.
Hope this is
Uh,
answered.
Thank you, ma'am. And Dr. Saral Chopra is asking, can you share an example where identifying the miasm completely changed your prescription and the result in the patient?
Okay, I think
There would be multiple, I'm guessing.
yeah, there are multiple such. Okay, let me share this example with you. I don't know how much time. Yeah, we have time. So let me share this example with you. Um, I have this patient who is like a regular patient of mine, and this lady around in her 40s, and she is with me for hypothyroid as well as for anxiety. Okay, so anxiety neurosis is there in her. And this lady, she had an ailment. Now she shares a very good relationship with her mother. Okay, but and every time the mother calls her, she would leave her house and go and pay a visit to her. And last year Diwali season, uh, uh, she couldn't go and meet her when she called, and she directly denied. Okay, and then at that very episode the mother passed away.
Oh.
And yeah, this lady had a very strong guilt where she feels that she was always there, but she couldn't be there in the last hours with her mother, in the last time with her mother. Now, so far, this lady was in the psychosis presentation. Okay. Her constitution always that I has to give her was Calcarea Foss. Okay. And she had this psychosis presentation all throughout. Now, I don't think so. I need to go into details of the psychosis
No.
presentation,
Huh.
but yeah, but then what happens now is she is into deep guilt. Okay. And she now goes into a depression. Okay. Her presentation changes completely. Her presentation, whatever she was, her presentation changes completely. She is into a depressive phase. The first two visits that she came to me, I did not assess the miasm. I did not understand that, yeah, there is a miasmatic change also. I was just going on presentation by presentation. Okay. But I was not finding the result that I usually find. I was not finding it and not satisfied with the process, the cure. She was feeling better with the remedy, and again she comes back. Then again she feels better, and again she comes back with the similar symptoms. Her core issue was not getting resolved. I went through more details and I realized that her miasm was now syphilitic because I was focusing on the symptoms of depression. I was focusing on her changes of her behavior, her attitude, her attributes. But I couldn't focus on what she was passing through. She was always complaining of one symptom, that the heel pain has increased. The heel pain has increased. Okay. And then in the second visit after this episode, the second visit after this episode, I asked her to tell more details about her heel. And then she said the heel pain has increased so much that it pains as if it is injured inside. It pains as if there is a fracture inside. And probably if I press it, अंदर से तो वो ऐसे लगता है कि इतना बाहर निकल गया कि मेरा खून ही निकल जाएगा अगर मैं उसको हाथ से प्रेस करूँ तो. So I was now realizing, okay, the miasm is shifted from psychosis now to syphilis. and she is going more towards a syphilitic presentation. If this moves further, probably she will start developing more syphilitic symptoms, and then suicidal symptoms, and then so many other things that can also come up. That is when my vision shifted completely. Entire case, and now I prescribe phosphoric acid to her, okay, which is again syphilitic. And now the next visit she comes, she's so calm, so much better with just one single dose of phosphoric acid. She's so much better now. Her heel pain is also almost completely gone. She doesn't have those intense heel pain feelings, the sensations, and emotionally also she's much, much better, able to relate with herself and her family in a much better way. So yeah, I think Dr. Saral, this could be a explanation to you for an example.
Perfect example of how shifting of miasm affects the prescription choice also.
Yeah.
We'll take one more question. Dr. Shreya is asking, how does Psora create the susceptibility within a person when Psora actually diminishes the vitality of a patient by creating disease?
Yeah. So now I want to come to this again. Sora is not creating your disease. Sora is expressing the disease. We have to be clear about this. This understanding, we have to be very clear. Now, I can see on Dr. Noori's face also that she's also a little confused by this statement. It's okay. I'll explain it. What causes disease is derangement of vital force. When the vital force weakens, a disease comes up. Okay, so disease is created right from the time the vital force is deranged. Now, how the disease will appear will be decided by Sora. So Sora is not causing your disease. Sora is expressing your disease. Your disease is expressed depending on which is the activated miasm, which is the predominant miasm at that point of time when your when your vital force is deranged, which
Right.
miasm gets activated. Okay, this we have to, be able to differentiate and understand.
It
By
happens
this,
over time, I think.
yes, yes. And by this, we can also understand that what part of that individual, or when a patient is coming to us, what is it that we can cure in the patient? Now, there are so many things that we can't cure in a patient. It's not possible because over a period of time in mankind, over a period of time, right since the time mankind has come up, there have been so many complications, so many permutations, combinations. Like, for example, if there is renal stones, and if person has already undergone a surgery, okay, that means that is a limitation. That is an artificial chronic disease is already formed. There is a limitation. We can't cure this patient now 100%. No cure is possible. Okay, yes, we can treat. Every time the patient comes up, we can reduce the miasmatic load. But already a surgery has taken place. So that artificial disease has already come up in this patient. We can't. We can't cure this patient per se. Right?
Right. Uh, Last question of the day. Dr. Anushka Desai is asking, ma'am, how all three miasms can be present at the same time? Can Sora turn into psychosis or psychosis turn into syphilis, or how and how they are treated?
Okay. So there have been a lot of theories by a lot of stalwarts, all respect to every one of them. Dr. Hahnemann doesn't say this, that of all that I have read and of all that I have understood of chronic diseases of Organon, Dr. Hahnemann has never mentioned in his theories or in his say that Sora will convert to psychosis or psychosis will convert to syphilis. He's never said this. Okay. Um, there are a few stalwarts who say that this is occurring. There are a few stalwarts who also say that all three miasms are present in an individual when that individual is born. Okay, and depending on the intensity of the ailment, depending on the condition of the vital force, depending on that individual, and so many factors around, which miasm will activate and it will start showing its presentation. Nobody of us can say that. It all depends on the causations. Okay. And then there is another school of thought which also says this, that every person who is born with that miasm will have that same miasm going on over a period of time throughout the life. But now the concept of miasm is so complex, or rather, miasms have become so complex that every individual is born with a complex sauropsychosyphilitic miasm. It is. Our previous generations to generations had already been in a double complex. No, not the double complex that we're talking about, similar disease. We are talking about complex miasm. And now they are becoming more complex because of the food that we get, because of the food habits that we have, because of all the other habits that are now culminated, because of the use of screen, and so many different things, which are factors for the vital force to weaken, which are factors for the miasms to again arouse ahead. And how to treat all of them, I think Dr. Anushka will need to have more such sessions for us to discuss about in this entity.
Yes. I think this session needs few more repetitions till we get clearer and clearer. And one question from my side, ma'am. Given your expertise on organon, can you please share your idea of the book that you were the contributor, Spirit of the Organon, and who do you recommend this book?
Yes, so I have been a contributor and a part of TC Mandal's Spirit of Organon. This book is very well edited now. I went through this book, and we are a lot of contributors in the book. So you could see in the field of homeopathy, all the teachers who are teaching organon all over the country have been a handful of us have been uh, a part of rewriting, or you can say editing of this new book, the chapters of this book. And it is the most upgraded version of organon so far. And everybody, each and everyone, including students, including practitioners, including teachers, each one of us can use this book for understanding the concepts of homeopathy. I have contributed in 2 chapters about aphorisms, about the first year syllabus of the aphorisms currently according to the CBTC. And yeah, you can go through that book. It's chapter number 16th and 17th. And you can find my views and my ideas of what I have put in that particular book. And Spirit of Organon, yes, by Dr. T.C. Mondal. It is an excellent book. And I congratulate the BGN team to come up with, you know, these concepts, this way in which y'all are upgrading the books which are already been present, and putting in the current understanding of the teachers who are there right now as well. So yeah, congratulations to you for doing such a great job.
Thank you so much, ma'am. I have to say it's been an absolute pleasure to have you with 360 today, and I'm very sure the engagement of the audience makes us feel that this has been one of the successful webinars. And teachers like you are really the torch bearers of the future, brighter future of homeopathy. So thank you for your time that you took out from your busy schedule, and thank you, audience. Have a great day. Thank you, ma'am.
Thank you, Nuri. Thank you very much.
Thank you. Goodbye, everyone.
Bye.